opportunity to be here this morning to discuss eliminating health disparities in the Commonwealth. Despite the progress that Massachusetts has made in extending health care insurance to nearly all of its residents, startling disparities in health care access and health outcomes exist between different demographics. Some of the most startling disparities are determined by disability and racial status, as persons with disabilities and communities of color face disproportionately higher rates of illness and mortality than residents of the state as a whole. For persons living with certain physical disabilities, accessing even the most routine medical procedures is difficult, if not impossible, when healthcare facilities do not have the appropriate medical equipment to serve them. Routine weight checks, mammograms, pap smears, prostate exams, and other healthcare screenings that can save lives are denied for many individuals when inadequate equipment exists and there are no adequate facilities to serve people. This results in higher rates of preventable disease and premature preventable death among those with disabilities. A lack of appropriate medical equipment is just one of the barriers facing people with disabilities that lead to costly and startling health disparities in Massachusetts. S. 819 would require providers to have accessible medical equipment and would establish standards for medical diagnostic equipment. This is an important piece of legislation to ensure that healthcare services are truly available for all. S. 800 also addresses those barriers for children and families. Healthcare for All supports both S. 819 and S. 800, as we must ensure that everyone is able to access basic healthcare services regardless of their disability status. Another glaring set of health disparities in Massachusetts is evidenced by the gaps in health outcomes based on race and ethnicity. The state's residents of color face higher rates of illness and mortality than the majority population and have worse health outcomes for nearly every key health indicator. Even when socioeconomic status and health insurance coverage are equalized, minority populations still live shorter, sicker lives. The factors behind these disparities are complex, involving social and economic factors, racism, and discrimination. Such a complex web of issues requires a comprehensive state strategy that works at a systemic and community level to ensure that every resident of the Commonwealth, regardless of race or ethnicity, has an equal chance at living a healthy and full life. S. 810 and S. 811 provide the strategy through a statewide Office of Health Equity that coordinates initiatives to reduce disparities across all relevant state secretariats and establishes a community grants program that provides resources to local community agencies to deliver interventions based on best practices that are shown to have had a significant impact. Healthcare for All supports these pieces of legislation as they are small investments in a long-term strategy that will improve the population health and strengthen the communities across the state. I'd also like to note the connection between these two types of disparities that have led to the breadth of legislation that you're hearing about today. Communities of color are at an increased risk for disabilities and can face a dual burden of barriers and challenges in navigating the healthcare system and achieving positive healthcare outcomes. We need to look more deeply into the intersection of these types of disparities. Healthcare for All supports S. 858, which would add a disabilities expert to the state's Council on Health Disparities. We believe that this would allow us to do a better job of identifying and eliminating health disparities. As we celebrate the success of Massachusetts healthcare reform and work on the next phase of the law's implementation, we must tackle the unsolved, difficult, and complex issue of health disparities. It's costly and unconscionable for any of our residents to have less of a chance at being healthy than another due to their skin color, ethnicity, language, or physical or intellectual ability. We all suffer when there's inequality. We must work to eliminate these health disparities to ensure the success of healthcare reform and the health of the Commonwealth's residents. I'll submit written testimony that's more complete to the committee, and I thank you for your time and your commitment to eliminating all health disparities.